Since 1926, the DOH has regarded tuberculosis as one of the most common causes of mortality in the Philippines. Tuberculosis lines fifth among the top 10 diseases that cause mortality in the country. It is estimated in 2015 that almost 70 people die from it every day, and an estimated 290,000 new cases every year. There are currently 4.8 million recorded cases as of today. People at risk may be the ones who are immunosuppressed, undernourished, on substance abuse, with chronic diseases, and whose graphic locations are somewhere compromised.
Hoy pare, kumusta si FM mo? Hindi ko alam.
Grabe pare, ang hirap.
Sobrang hirap. Hindi ko alam. Sana pumasa. Ay, sorry pare. Hindi ko sinasadya.
When the droplets are inhaled by another person, they travel down the person's trachea to reach the lungs where they get deposited in the alveolar sacs. Here, the TB bacteria multiply, activating the body's immune response, resulting in macrophages surrounding the bacteria to form granulomas, thereby preventing the spread of TB infection in the lungs. In the first phases of the infection, the patient tests positive for latent TB within 8 to 10 weeks. During this time, the patient will not manifest any significant symptoms or will only have fever. Because of the bacteria's increasing population, the immune system will eventually detect it again. 3 weeks after infection, the immune system finds another way to counter the bacteria. The T helper cells are activated in order to kill the bacteria. Latent TB infection can progress to active TB when the bacteria break out of the granulomas and multiply in the lungs, making the patient symptomatic with the likelihood of infecting other individuals, which can happen immediately after the infection or not at all. In active pulmonary tuberculosis, the patient does not feel well, along with fatigue and weight loss, which develop gradually over several weeks. Or he may have more specific symptoms. Cough is the most common.
Kamusta kami?
Okay lang ma. Pagod sa school, tas uso kasi ngayon.
Evening chills and drenching night sweats may occur. However, they are not specific for TB. There are bouts of chest pain and difficulty of breathing and fever that is usually low grade but still may vary. There is also loss of appetite and a progressing cough that may be blood-stained. Although these are the usual occurring symptoms, cough that is progressing and lasting for more than 3 weeks is still the most common. There are tests that are used to detect tuberculosis bacteria in the body. TB skin test, TB blood tests, chest x-ray, and a sample of sputum are needed to see whether the person has TB disease. With active tuberculosis, the patient must take antibiotics for at least 6 to 9 months. These 4 medications are most commonly used to treat tuberculosis: rifampin, isoniazid, pyrazinamide, and ethambutol. Based on the results, the patient usually takes 3 or 4 medications for 2 months. Afterward, he'll take 2 medications for 4 to 7 months. Administrative controls are the first line of defense, and is the first priority regardless of the available resources. These include placing signs and posters about cough etiquette, providing tissue papers, disposable surgical masks, and ordinary cloth face masks to coughing patients and infectious TB patients, and providing daily health education on cough etiquette. Environmental control, on the other hand, is considered as the second line of defense, and this can be done by opening windows and doors to improve natural ventilation, and covering mouth and nose while sneezing or coughing. Last but not the least, respiratory protection control is the third level of a TB infection control program and consists of the use of personal protective equipment in situations that pose a high risk for exposure to TB disease. After all, prevention is still better than cure.